Well, steady as she goes, MyEFO, the budget update from the government not containing much new spending. There was a little bit in the aged care area, not enough for plenty of the advocates. Joining me now is Tim Hicks, General Manager of Policy and Advocacy at Leading Age Services Australia. Thanks very much for your time. So we had $87 million for aged care. Do you welcome that as a boost at a pretty austere time otherwise for the government?
Well, there was some new funding announced for aged services in the MyEFO, but most of that was for system administration. It was for the Department of Health and the regulator, not for the delivery of services. And one thing that's quite striking about that is a big chunk of it went to the department to pay for their response to the Royal Commission. And this is in addition to the earlier funding allocations. Aged care providers, they didn't get anything for the significant cost of responding to the Royal Commission, and so they've got to find a way of balancing their books while continuing to deliver care.
But when else do you have a Royal Commission where anyone attending gets paid to do it? I mean, is there any precedent for that?
Well, I don't think the sector's really asking to get paid to attend the Royal Commission. All they're really asking is for the costs of care to be covered. And the main issue is that wages and other related costs of care continue to increase much faster than the level of funding. That means that providers don't have a sustainable surplus, and it means when unexpected costs come along, like a Royal Commission, or it could be a natural disaster, it could be an outbreak of influenza or a worse than expected flu season, there isn't the fat within the budget to cover those costs.
But that'd be a pretty unusual move, wouldn't it, for a government to pay costs for people giving evidence at a Royal Commission, when in some cases they might have been found to have had bad practices on top of that?
I suppose we're not really asking the government to pay for the costs of attending the Royal Commission. It's just striking that the government is willing to cover their own costs, but not willing to cover the costs of delivering services. And one of the things that we see in this update is that the costs of care are there, regardless of whether they're funded by government. So, in a sense, by achieving a surplus and by focusing on achieving a surplus, we're not necessarily eliminating the deficit, we're just hiding it on the balance sheets of non-government organisations, of churches, community groups and small businesses.
Well, depending on what organisation you're talking about, I mean, there are still places making money. But on the issue itself, home care packages, is that still the big one in the budget, do you think?
So the government's clearly made a significant new investment in home care packages, $500 million over the remainder of this year and just into next year. That's significant. What's missing is a long-term plan to bring down the queue, which is currently sitting at 120,000 people.
Well, do you take the 10,000 off from the last package, though? That was going to be another 10,000 places, wasn't it?
So there'll be another 10,000 places, and you've got to remember that people move through the system over the course of the year, so we may end up taking a bit more than 10,000 off the total size of the queue. But in the long term, we still clearly have demand that exceeds supply, and the government hasn't mapped out a way of eliminating that. And what it means is that the sector has to jump to respond all of a sudden every time the government announces a new set of packages, rather than being able to build up capability in a measured way. Right,
so you want it in the May budget, because that's clearly the next hope, say a 3-4 year plan, and that means people can build up staff, organisations can build up staff. You can actually start to tackle that list over that sort of period of time?
Yeah, what we've called for is for the government to set maximum is for the government to set maximum wait times for home care. So we've said that eventually they should be no more than 3 months, but they don't have to start there. They could start at 18 months, noting that the average wait time at the moment is about 2 years. And the government could legislate that those will progressively be brought down to that 3-month maximum. That would provide certainty to the people waiting on the queue about when they're going to be delivered services. All it would mean is that the government would have less certainty about its own budget.
Well, I mean, it's not so much legislating, is it? It's having the capacity to do so. If you legislate and the money's not there, it's not going to happen.
Well, the money is there. The government does have the money to...
No, the funding, I mean, the set funding is the more important part. What would we be talking about finally? What would that package look like in extra dollar figures over, say, forward estimates?
Well, I don't think anyone really knows. The Department of Health has told the Royal Commission that it had cost about $2.5 billion to eliminate the queue overnight. Part of the problem is we don't know what the response will be, because there's probably people who aren't currently on the queue. They haven't even bothered because they know that by the time they get to the end of it, they won't be in need of care anymore.
All right, so 2.5 plus, you might say.
2.5 in the plus more in the long term, I think.
Tim Hicks, thanks for your time.
Thank you.